Hi, Ian Cahill is my name. I'm a co-founder at Gewardz Health, and I want to thank you for taking the time to click onto our newsletter and hopefully scroll through this video to learn more about our business and how we help empower our clients to grow. And we see employee well-being as a key part of that, particularly in the current climate when it's becoming more difficult to find people to help businesses deliver on their services and products. Back in the late 2022, we got asked by a client of ours, how do we help our employees? And I made the statement, well, offer them healthcare, to which they said, but we can't afford health insurance. I said, that isn't how the healthcare market works. If I worked for a large organization with 2,000 employees, I'd have access to a healthcare solution that doesn't require health insurance. And so they asked us to help build a solution that would help them as SME business owners to be able to offer healthcare to employees. During 2024, we got invited to be the preferred healthcare partner to the Small Firms Association. And we're delighted to be able to help the SME sector reward, retain, recruit, and compete for good people. When we began exploring back in 2022 what the landscape for employee well-being looked like, particularly in the SME sector, we kept hearing things too small to serve. Large organizations only wanted to deal with large organizations to the detriment of SME business. And secondly, standard EAP or employee assistance programs don't work. Less than 1% utilization engagement, which means that the value being spent by companies is questionable. Key health challenges that every business face for their employees are GP access when they become sick, anywhere from 1.5 to 3 days for GP appointments. This increases the stress. It takes longer for employees to get back to work. Big thing for me is the financial burden. My own GP is €80 per visit for a prescription. Very quickly, we have a family of 6. That starts to become a huge financial burden. And finally, employees feel guilty for the time taken, increases the pressure on them to get back to work. Business challenges is all about lost productivity, downtime, absenteeism caused by waiting for GPs. Back research would say that people lose about 4 days a year just waiting for a GP appointment. The time it takes to get a GP prolongs the time that they're spent out of work. And of course, from a business owner point of view, if we consider that it takes about €130 for every day an employee is out of work, that starts to add up very quickly. In this time of diversity, equality, and inclusion, usually when children become sick, there's a call for parents to have to take time off, and that burden tends to rest with mothers, in this case 64% of the time. So if you've got an employee base that's split between male and female, and particularly where parents are involved, you probably know a higher absenteeism around your female employees, something we can help do something about. And for me then, you've got this growing squeeze middle. 70% of workers don't have an employee-sponsored healthcare, of which 55% of those are SME employees. Squeeze middle is defined as those who earn too much for medical cards but can't afford private health insurance. They face longer time for GPs, particularly more as you go further away from Dublin, employee disruption, and of course it becomes a huge problem for businesses about how do we fill the gap while our employees are out. We built our own app, very easy to use, and if you book a demonstration, I'll show you in 15 seconds how we can book GP appointments. But by adding in GP appointments alongside other well-being supports, it gives total workforce coverage. It's 10x. We see at least 10% of the workforce engaged in our platform on a monthly basis. And because we're available 8 a.m. to 10 p.m. 7 days a week, we take care of that lumpy Monday problem of employees being out of work sick waiting for a GP appointment. Our cost, less than 1 hour's wages per month per employee. We are throwing down the gauntlet to say that every business can now afford to offer a healthcare solution to their employees. Something well worth considering. Doesn't work. Stats for the last 3 months will show 63% to 40%. So roughly speaking, the green are females, the red are male. And you can see here diversification right the way from under 18s to people in their 60s. The good news is when you subscribe for an employee for Gewardz Health, you include not just the employee, but their entire household family members. That means particularly for those parents who've got children, the fact that they can see GPs quicker means that there's less downtime and they're able to get back working more quickly. I mentioned 7 days a week, so you can see we get people using this all week long. And so that's important. This idea of waiting for a Monday morning scramble. If I phone the GP at 8:15, I might get lucky and get a GP appointment that day. That goes away. We just take all of the stress and the risk away, and means that there's more likelihood of our employees being back to work on a Monday morning than waiting until Tuesday or Wednesday. And let's be honest, the reason why we phone our GP, 90% of the time it's because we're looking for a prescription. We know it's wrong. We just want an instant cure to that. So you'll see in this dynamic, it's 80% of the time our GPs will issue prescriptions once they've diagnosed the illness. Our GPs behave your own GP do. They will issue medical certs. All of our GPs are HSE registered, and that's very important. Some of the competitors in the marketplace don't use HSE registered GPs and can't issue sick certs and struggle to issue prescriptions. And where they believe that an employee needs further care, they will then provide a consultation letter to let them go and see a consultant. There's another piece we found in feedback from our clients is this sick note loop. They're out of work for 3 days, they come back, and then there's a requirement to get a sick cert, and so then spend a half a day trying to get time off for another sick cert. Again, all that goes away, all that reduces the cost and the inconvenience to the business. And then when it comes to duty of care, if I'm traveling or if my employees are traveling anywhere in Europe, we know that we can get them a GP through our service, and so it takes away some of the risk of waking up in a hotel bedroom going, how do I get a GP? I'm going to sore throat. While they're traveling on holidays, it's a very nice boost to be able to offer your employees and their families to be able to go and say, if you're away and they need a GP, we've got you covered. And we do this for our clients. It's a done for you service. We email out the employees. We do the follow-up emails. We've got a dedicated Ask Sarah service, and we issue monthly check-in newsletters to remind every employee that they have access to our service. And that's important because there are times our clients come back and say, Ian's claiming he doesn't know anything about the service. And we were able to go and say, he's opened 3 emails. And by the way, he's checking in the monthly check-in. We're about covering and working with our clients to be this outsourced service to make their life easy. And it's a win-win. From a reward point of view, no BIK. Once it's offered to all of your employees, because it has a medical connotation, there's no BIK. It helps you retain to be able to go back out to your existing workforce and say, thank you very much. In lieu of your loyalty, we'd like to offer you a healthcare benefit. And so it prevents the opportunity for somebody to look around because they feel more wanted and more appreciated. From a recruitment point of view, it goes beyond just being a salary. You're not just fighting over salary. Everybody can say, by the way, we can give you a healthcare benefit as part of your offering. And ROI, it is about getting people back to work quicker. We'd love to help you succeed. We'd love to partner with you. If you'd like to know more, please email me back. I'm more than happy to set up a very brief conversation, demonstrate how easy our system is, and see if we can add value. Thank you very much for listening.